The vaccine inequality between the rich and poor nations is as stark as the economic disparity between them. While some countries are rushing to give booster shots to its people in the face of the new COVID-19 variant, others have not been able to fully vaccinate even 10% of their population. They do not have stock at all. South African countries, from where the new variant is said to have emerged, have very low vaccination rates. Overall, just 6% of the population in Africa has been fully vaccinated against COVID-19. Now, more than 30 countries have banned travel from Southern Africa. Rich countries continue to hoard vaccines when redistributing them to lower and middle income countries is the need of the hour. High income countries have administered 120 doses per 100 people compared to just 3 doses per 100 people for low income countries. Eminent epidemiologist Dr. Jayaprakash Muliyal spoke with us on the importance of vaccine equity.
Vaccine equity is an important issue to globally reduce mortality due to COVID-19 and consequently bring down the perceived public health importance of the disease. COVID-19 should eventually become an infection of no serious consequences. It's not easy to link emergence of new strains with vaccine equity or absence of vaccine equity. Immunodeficiency due to other reasons like HIV may facilitate these emergences.
Even as wealthy countries rush to expand booster campaigns, others are not even able to vaccinate their most at-risk people. The World Health Organization has now warned against giving COVID-19 booster shots to healthy adults, saying that hard-won gains could vanish in an instant. By the end of October, wealthy countries had donated only 10% of the 1.3 billion doses they had pledged to global vaccine sharing program Covax. Covax aimed to secure vaccines for about 100 low and middle income economies at the same time as wealthier nations. It has so far shipped 580 million doses against its downwardly revised target of 1.425 billion doses by the end of 2021. The reduced supply to Covax came at the cost of rich countries hoarding vaccines. Doctors Without Borders estimates that 10 high-income countries, including the US, UK, Germany and France, would be holding 870 million excess doses by the end of this year, even after boosters have been administered for high-risk groups. 241 million vaccine doses held by just the European Union and G7 countries could expire if they are not used by the end of 2021. At the same time, rich nations have also consistently opposed patent waiver on COVID-19 vaccines. The idea, which was first proposed by India and South Africa a year ago, would have allowed companies in developing countries to freely manufacture cheaper versions of the vaccines. Despite support from over 100 countries, including the US, the waiver of intellectual property related to COVID-19 vaccines is yet to be approved at the World Trade Organization. While experts might not strictly link the lack of vaccine equity alone with the emergence of new variants, it cannot be denied that if indeed Omicron originated in Southern Africa, then greater vaccine coverage in that region could have reduced the chances of such a thing happening.
Last year, November, December, the vaccines were rolled out outside. In India, we started it in January of this year. It's unfortunate that a lot of the developing countries have not got the requisite vaccines that were promised. And you look across, whether it's Europe, USA, they have immense quantities of vaccines, and even some of them are nearing expiry date. As they say, I'm not safe till my neighbor is also safe. So if my neighbor's house is in fire, my house also will catch fire. So I think so. We need to be very clear. It's a global village now. None of us are safe if our neighbors are not safe. So we should have ramped up the vaccination. I think so. Now, obviously, in hindsight, all of us become wiser. But to be fair to the WHO, the Director General WHO, Dr. Tedros, has been speaking on this on multiple times. Whenever the booster topic came up, it was, for heaven's sake, let us spread the vaccination across the globe, give it to the areas of the place where it is most required, in Africa. And he kept on harping on Africa, and that is what has happened. If you look at this Omicron that has come out, it was detected in Botswana and South Africa. And to be fair to them, they had the foresight, they had the courage to speak up, do the genome sequencing, and tell the world that this is there, and let's be careful. Unlike what happened early last year from a neighboring country. So I think so that's something that's very important, that vaccine equity is something that we let go. We didn't supply to everyone. And the other thing which happened also in India is that we, because of our second wave, which hit us very brutally, we were just prior to that, we had started our export of vaccines. But when our second wave hit us, we had to stop it. So that also played a significant role, if I can put it. But I don't blame the government of India, because first of all, we have to save ourselves also, because it was very brutal. But I would like to hold the European countries and the USA also accountable on this, because they had surplus. We didn't have surplus.
Vaccination is currently the strongest weapon we have to avoid the emergence of new variants. Experts say that only a significant level of global immunity can limit the spread of new variants, as well as reduce the opportunity for them to emerge in the first place. It is high time that rich countries start diverting doses to the developing world, as inequitable distribution of vaccines will only prolong the pandemic.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.